principles of pharmacokinetics. Pharmacokinetics means the movements of drugs in body. The movements of drug in body means how the drug is traveling from site of administration to blood, and from blood how it leaves the body. This is called pharmacokinetics. In pharmacokinetics we have principles. Four principles mainly, are three principles. First is absorption of drug. This is the movement of drug from the site of administration to blood. This is called absorption. Distribution is the movement of drugs from the blood to body target tissues. Metabolism, for metabolism also the drug is traveling in body. For example, if we take the example of vitamin D is activated in two organs. First in liver, hepatic activation and renal activation. In hepatic, in liver, on 25 number carbon hydroxyl group is added, which is called 25 hydroxy cholecalciferol, and then this is still inactive. 25 hydroxy cholecalciferol travels to kidney, and in kidney, in proximal convoluted tubules, an enzyme very important, alpha 1 hydroxylase enzyme, add another hydroxyl group to 1 number carbon of cholecalciferol, and now the vitamin D is fully activated. So for activation or for metabolism, the drug is also move in body. So metabolism also include in pharmacokinetic principles. And last, excretion is also the movement of drug from body, outside body. So the principles of pharmacokinetics are absorption, distribution, metabolism is also known as biotransformation, and last is it is excreted from body. These are the principles of pharmacokinetics. It is according to your syllabus. Now we will discuss the principles one by one. In absorption, mainly we will focusing on absorption introduction, mechanism of absorption, factors affecting absorption, and bioavailability, and factors affecting bioavailability. This is our topic today, right? What is absorption? What is drug absorption? Anyone? It is the movement of drugs from site of administration to bloodstream. There, if we take the drug orally, it will follow two circulations. One is portal circulation, the second is systemic circulation, right? But if we take a drug in IV route, it will bypass the liver or portal circulation and directly it is added into systemic circulation, right? So the movement of drug from site of administration. For administration we have lot of routes: IV, IM, subcutaneous, oral route, rectal route, vaginal route, topical routes, eye drops, air drops, right? So we will take oral route because this is one of the acceptable route by patients, and this is one of the feasible. This is administration of drug. After administration, this drug will move to portal circulation. What is portal circulation? Portal circulation is the circulation between GI and liver, and all the nutrients, drugs, etc., poisons, when we take orally, it will follow this portal circulation, and from site of administration it will go to liver, and liver is the one of the main organ for metabolism, right? And in metabolism we have three processes or four processes. If the chemical is inactive, it will be activated. If the chemical is active, it will be inactivated. If the chemical or drug is hydrophilic, it will convert it into hydrophobic. If the drug is hydrophobic, it will be converted into hydrophilic. And if the chemical is toxic, it will be converted into non-toxic. So this is portal circulation. After portal circulation, it will go to liver, and from liver it will go to the venous drug, the venous blood, the hepatic vein, which is following the route from liver to heart, from liver to heart. For example, this is heart, and after entering the heart from left ventricle, it will be added into systemic circulation, right? For example, we have taken a drug orally. First, it will be moved to portal circulation. From portal circulation, it will follow the passive transport, active transport, endocytosis, either one of that, and it will go to liver. From liver, it will transfer into the hepatic vein, and hepatic vein will be drained into inferior superior vena cava, and it will go to the right atrium. From here, it will go to the left ventricle, and from left ventricle it will be added into systemic circulation. This whole movement of the drug is called absorption of drug. How we can define this? The movement of drugs from site of administration into blood stream. Either the blood is portal, venous or arterial, but the movement of drug from the site of administration into blood is called absorption. This whole step is called absorption of drug. This is administration site, this is portal blood, and this is systemic blood. This whole mechanisms and the way all the mechanism followed by this drug are included in drugs absorption. What are they? First pass metabolism, bioavailability, right? All these things are included in drugs absorption. Now the mechanism of absorption shortly, because we have discussed this in detail in first lecture. But for example, if I have one cell membrane from here, this is cell membrane of any of the cell. It may be of capillary wall, it may be of hepatocyte, it may be of GIT, may be intestine, duodenum. This is cell membrane, and cell membrane is composed of phospholipids. This is lipids bilayer, and this lipids bilayer will favor the lipophilic material. If the drug is greatly more hydrophobic, it will move from this membrane easily. If the drug is hydrophilic, it will not cross this membrane. But remember one point, that if the drug is extremely lipophilic, it cannot travel through this membrane. Why? We will explain this, right? चकटी भी अच्छे नस्के निश्चितले ठीक दा अगर अपार अखपल conditions देखा. First, this is mechanism of absorption of drug. Absorption of drug. First one is, for example, these are the conditions. First, for example, I have a drug here. What are the body compartments? Body water compartments. Drug distribution kalha. Dil tarash. Drug distribution. After drug absorption, we have drug distribution. The drug distribution is dependent upon the body compartments of water. For example, we have one compartment is blood plasma. Second is extracellular fluids. Third is intracellular fluids. And fourth is total body water weight. Right? For example, we have plasma, it's approximately 4 liters. Extracellular fluids are 8 liters, intracellular fluids are 24 liters, and whole this make 42 liters of water, right? So this is cell membrane. Any cell membrane, it is maybe from blood capillary wall, it may be from hepatocyte, right? We will discuss distribution, and we will see that capillary permeability also influence this absorption and distribution. But for example, I have a drug here, and the characteristics of this drug is, for example, this is a drug, right? And the characteristic of this drug is, first, it is hydrophobic, mean this is more lipophilic. Second, it have low molecular weight, and it have low charged, right? This drug will follow patio transport, and it will cross this membrane. This is one body compartment. For example, this is extracellular fluids, and this is plasma. This is another body compartment, right? From one body compartment, it will travel into another body compartment, crossing this barrier, cell membrane, right? It will dependent upon hydrophobicity or hydrophilicity, low molecular weight, and charges on drug. So it will follow patio transport. This is called patio transport. What is patio transport? The movement of drugs from high concentration into lower concentration without the use of energy. This is called patio transport. But if the drug is having low molecular weight and having low charge, but the drug is hydrophilic, it will also follow the patio transport, but it will travel within specific channels, right? Because this is hydrophilic drug, it cannot dissolve in this cell membrane, and it will follow this specific channel. For every drug there is a specific channel, and this drug is moving from here to another body compartment in concentration gradient, mean from high concentration to low concentration, and this is also called patio transport or patio diffusion. We will differentiate this on aqueous and lipids, non-aqueous. This is called lipids patio diffusion, and this is called aqueous patio diffusion. The next is actio transport. What is actio transport, or what are the properties of drug for actio transport? The drug will be having high molecular weight, having charges, right, or no charges, and it is moving from low concentration to high concentration, mean against concentration gradient. But the protein which are responsible for this active transport will do conformational changes by using ATP. It will hydrolyze ATP into ADP and takes energy from ATP and will open or close the channel, right? One another thing, this passive diffusion, it cannot be saturated, non-saturated, because this is lipid soluble. But this, it can be saturated, and we can block this channel by competitive inhibitors, right? This diffusion, active transport, for example, here we have protein extrinsic, intrinsic for transport, right? But it will use ATP, it will hydrolyze ATP into ADP, and the drug is moving from low concentration into high concentration. This is called active transport, right? The next is facilitated diffusion. Facilitated diffusion is also a type of this active transport. Or active transport is also a type of facilitated diffusion, but the only difference is it is moving from low concentration into high concentration. And in facilitated diffusion, also when there is some proteins present here, it will do some conformational. What are the conformational changes? For example, this is the conformational change, right? And this drug is moving from high concentration into lower concentration without the use of energy, but only use these facilitated proteins. So it is called facilitated diffusion. It only use facilitated proteins, so it is called facilitated diffusion, right? The next is endocytosis and exocytosis. Endocytosis and exocytosis. Very large, this is also high molecular weight, but very high molecular weight, very large size drugs. For example, vitamin B12. This vitamin B12 example is from your book, right? This it have very high molecular weight, and this is hydrophilic or hydrophobic. Vitamin B12 is hydrophobic or hydrophilic? Hydrophilic. It is water soluble vitamin B, right? So first it will attach to some specific receptors on cell membrane. For example, here the vitamin B12 is attached. Mainly these are intrinsic factors, right? From here this membrane start folding inside, and this drug is trapped in this vesicle, and at last the drug is enclosed in vesicle. One benefit of this vesicle is it protects the drugs from outside environment or outside enzymes present in cytosol, etc. This movement is called endocytosis, and when the drug acts on target tissues and then wants to leave the cell, it is called exocytosis. For example, this is the cell and this is also the cell. For example, by endocytosis this drug came into cell, and by exocytosis it will leave the cell. Exocytosis and endocytosis. So this is the mechanism of absorption. Now we will go for factors affecting drugs absorption, and we also somewhat discuss the effects of diseases on drugs absorption, right? For example, factors affecting drugs absorption. Factors affecting drugs. What are the factors which influence or which decrease or increase the drugs absorption? First thing is, the first one is in absorption we have pH. The absorption of drug depends upon the environment from which the drug is absorbed. For example, the environment is acidic or basic. Second, it depends upon the hydrogen concentration, hydrogen ion concentration. For example, if we have a drug which is weak acid, and last you will answer me why all the drugs are weak acids or weak bases, not neutral, right? Think and then you will answer me. Weak acids, for example, weak acids. Generally, weak acids are what are the parts of duodenum? What are the parts of duodenum? proximal duodenum and distal duodenum. The acidity is very increased in proximal, right? Weak acids are generally represented by HA. This is, for example, weak acid. This weak acid is non-polar. Mean this is hydrophobic, not hydrophilic. It, when environment is provided, it will reversibly broken down into one hydrogen ion and one anion charge molecule. Can charge molecules absorb easily from here? No. Charge molecules are, if the drug having high charge, it cannot cross this membrane. For example, this is a drug having high charge, it cannot cross this membrane. So this thing is acid and this drug is polar. This is polar. What is needed, that we will shift this reaction in reverse direction. We will shift this reaction in this direction. For example, this is stomach. This is your stomach, and this is proximal duodenum, and this is distal duodenum. This is distal duodenum. This is proximal duodenum, right? In stomach epithelium, this is stomach epithelium, we have special pumps for which ion? Hydrogen ion, because acid stomach is very acidic. It will take hydrogen ion from extracellular fluids. Mean that in stomach this hydrogen ion is already present. This hydrogen ion is already present in stomach. What's needed, that we will give the drug in this form. If we want to shift this reaction in reverse direction, this hydrogen ion is present already in stomach, we will give the drug in this form. If a person or patient taking this drug in polar form, this is polar form, in stomach it will react with, for example, this ion react with anion, and it will form this weak acid, right? So from here, this is acidic environment in proximal duodenum. This is acidic environment. From here it will absorb very easily. Why? Because this drug have low molecular weight, it have no charge, right? It is not hydrophilic, right? So it will be absorbed from here very easily, right? If we want to take the drugs which are weak acid, we will give that drug in charge form or charge status, because in stomach hydrogen ion is already present. It will react with that drug and will form a non-polar molecule, and non-polar molecule will be absorbed easily from proximal duodenum. This is acidic environment, right? The drug which follow this rule is aspirin, disperine, right? If we take the drugs which are very weak bases, for example, I have a weak base drug, but in this form it is polar because it has hydrogen ion. If we provide environment to this weak base, it will reversibly break down into B plus H plus ion. In this form, this is non-polar. This is non-polar. Now it is needed that this reaction will be shifted in forward direction. We will choose a form of drug which form this thing inside the distal duodenum, because in distal duodenum we have alkaline environment, right? In alkaline environment we have decreased, for example, again this is stomach, this is proximal duodenum, and this is distal duodenum. Here the hydrogen ion concentration is high because this is acidic area. Here hydrogen ion concentration is low, right? So when we give the drug in this form, if we give the drug in this form, it here hydrogen ion is, for example, here is no hydrogen ion, it will not react, right? It will not react, so the weak base will absorb from here very easily into blood. One factor other than this weak acid base, one other factor is there is very high surface area, and this base will be absorbed rapidly from proximal distal duodenum and small intestine, right? The next factor is blood flow. Next factor is blood flow. Weak acids, weak bases will be highly absorbed from alkaline environment, and weak acid will be from acidic environment. The next factor is blood flow. If a tissue have high blood flow, the drug absorption to blood will be very high, right? For example, if blood flow is high, absorption of drug will be high. If blood flow is low, absorption of drug will be low, right? Skin, adipose tissues, cartilages, and have low blood supply. So from skin, from adipose tissues, and from cartilage or for some subcutaneous tissues, the absorption will be low. And for example, we have brain, liver, kidney. These organs have very high blood flow, so drug absorption will be very high from these organs, right? For example, a patient is in the shock position. Here, listen this very carefully. If the patient is in shock, hypovolemic shock, for example, shock. What is shock? Low blood supply. Disturbance between demand and supply. If the patient is in two very specific shocks, hypovolemic, if the blood fluid is body fluid is decreasing, and if cardiogenic shock. In contrast of these shocks, if we have septic shock, sepsis, and sepsis, the drug distribution will be high because the blood permeability, capillary permeability increases in septic shock. But in hypovolemic shock, in cardiogenic shock, the blood supply will be, the blood flow will be very low. So absorption of drug will be very low. Mean that in shock we will give high doses of drug. अब हम सेवा को IV route मान. So these are this is the second factor. This is the second factor which influence the drug absorption. The third is total surface area. Total surface area. For example, we will compare stomach and small intestine. Stomach and small intestine. But generally, when total surface area increases, absorption increases, and when total surface area decreases, absorption will be decreases, right? If we compare stomach, this is stomach, and for example this is duodenum, and these are small intestines. In small intestines we have 1000 folds of per cubic, we have 1000 folds of microvilli. For example, these are micro, and every villi have a very rich blood flow, right? But if we compare the small intestine with stomach have very less folds, right? So stomach have low surface area and small intestine have high surface area. In stomach the absorption is less, and in intestine absorption is high. Now we will compare the empty stomach and full stomach. If we take the drug with empty stomach or with full stomach, every drug with full stomach decreases the absorption rate, because the drug is not available for the surfaces of cell. For example, we have two stomachs, one and so दूसरा ड्रग्स जैसे चागस्ता epithelium effect कई क्या. We have two stomachs. One is full of food and this is empty. This is empty. From here the absorption will be high as compared to full stomach. Absorption will be low, because this drug, for example, this drug is present on here and this drug is in contact with cells, right? So absorption in full stomach is low as compared to an empty stomach, but it is dependent upon the drugs and dose, right? If the drug is harmful in empty stomach, we will give to patient it with full stomach, right? The next factor is solubility. P glycoprotein, but solubility. Solubility, this is simple thing. If the drug is lipophilic, mean the drug is hydrophobic, the absorption will be high, right? And if the drug is high hydrophilic or lipophobic, the absorption of the drug will be less. But one point is very important: when the drug is very extremely lipid soluble, it cannot absorb readily, because for example we have, this is one compartment of body, this is the blood compartment of body, and this is the body tissue. Here this is water, here it is water, it is water and water. So the drug which is feasible for absorption, it is must that some of the drug is lipid soluble and some is water soluble. If the drug is highly lipid soluble, the drug cannot stay here in water environment, and it have no contact with cells and it will not be absorbed from here. And this is the reason why all the drugs are weak acids or weak bases. right? So this is the solubility. The next is P glycoproteins. P glycoproteins, or we can simply say that expression of P glycoproteins. Some of the cells, for example the cells in placenta or the cells in brain, they are not permeable to any drug. The specific drugs which can cross placenta and blood brain barrier. So the cells in the placenta and blood brain barrier have P glycoproteins, which is responsible for the drugs, which takes the drugs into the cell and out from the cell, right? For example, if I have, this is brain cell, and this cell have P glycoprotein. This is P glycoprotein. If we take a drug, and this is especially for brain, this transporter will take this drug into the cell, and this P glycoprotein is responsible to take this drug away from the cell. So if the body cells have a lot of expression of P glycoproteins, the absorption will be reduced. Why? Because, for example, if I have a tissue or cell here, and this cell have P glycoprotein, right? And this drug is trying to enter the cell through a specific channel. This glycoprotein is activated or expressed. It will not allow the drug to take actions in cell. It will break this drug and will eliminate from the cell, right? So if the P glycoproteins are activated, absorption will be reduced, and if they are not activated, absorption will be high. These are the factors which influence or inhibit the drugs absorption. So कोई न condition remaining there, the condition, the time of contact. And time of contact mean how long the drug is in contact with body tissues. For example, we have two patients. Time of contact. With tissues. Drug time of contact with tissues. For example, we have two patients. This is small intestine. These are the cells of small intestine, and this is another patient. Right, this patient is having severe diarrhea, right, and this patient is constipatio, it have constipation, right. Here the GI motility is very high, and if we give a drug to this patient which is caused by diarrhea, this drug will very rapidly leave the body or leave the intestine, and the time of contact with these cells is very low, so the absorption will be decreases. In comparison, if a patient have constipation, the GI motility is very low, and this drug having a high time of contact with these surfaces, and it will absorb very slowly and in very high amount, right. The next is, for example, if the tissue's protein binding is high, If we take the example of cyclophosphamide drug present in cancer, this drug have a very high tissues protein binding, and it accumulates in tissues, and that's why it have a very severe side effect which cause cystitis, the inflammation of urinary bladder, because in transitional epithelium we have a lot of proteins which bind specific drugs and accumulates in tissues and cause cystitis. These are the factors which change, influence the drugs absorption. Any question? उस question को